Hello everyone. If you are a junior doctor and you are considering moving abroad and you don't have any clear option in your mind and you are fed up of hearing about USMLE, PLAB, UK, Ireland and all the job saturation and everything, then I think this video is for you. Because in this video I'm going to explore a different option, that is a pathway to Germany if you want to work as a doctor in Germany. Let's get started. First of all, why to choose Germany? Why consider it? Lower competition as compared to US, UK, England, Ireland, and then salaries are good and the healthcare system is strong just like the other developed countries. And then direct pathway to consultant level is also there without waiting a long period of time to get into specialty training. Once you become a consultant, it is transferable. You just need to pass your exam, the language exam, and then you can work as a consultant in UK as well. If you want to work in Germany, then you should at least have 16,000 to 20,000 euros in your account if you want to pursue this career, because it requires loads of money. If you have decided that you want to work in Germany, you want to pursue this career pathway and you do have finances or you can make the finances available, then the first step will be to pass the German language exam. So German language exam, because you will be working in Germany and they speak German, you have to have this exam passed. The level required is B2 level. You have to clear your German exam and get B2 level. The good thing is you can study it online, you can study in wherever you are. You don't need to go to Germany to pass this exam. Once you have passed your exam, then you need to choose between the states. There are 16 different states in Germany. You have to choose which state do you want to work in, and each state has their own medical council and their own requirements. So once you have decided this is the state I want to go to and work, then you will go on their homepage, you will study what are the documents that are required, you will prepare those documents and send the state those documents. If they get approved, then you will be issued a letter, a confirmation letter. That letter is required to get a German visa. Next, you will get a visa appointment. If you are from Pakistan, it will take about 2 to 3 months to wait for the appointment. And the total process, not to this point, to get the visa and to arrive in Germany, it will take about 1.5 years to 2 years. And once you arrive in Germany and you're ready for your exams. Now the third step, I would say, so first you cleared your language exam, then you applied for visa, you got the visa, you are in Germany now. Now you are going to prepare for this exam. It's called FSP. Very difficult to pronounce, so I'll stick with FSP. It's a medical German language exam, just like PLAB, and it covers history taking, explaining procedures, writing patient's notes. So basically you will be demonstrating your medical knowledge skills in German language. If you pass this exam, then you will be allowed to work in Germany for 2 years, but it will be a non-training job. It won't be calculated as training job. The good thing is you will be given full salary and you will be earning good amount of money after that. Now, once you pass this exam, you got a job, then you need to pass another exam if you want to enter into training. That is called Kenntnisprüfung. That is a medical knowledge equivalent exam and you only have 3 attempts to make. If you pass this exam, you will be able to enter into specialty training. Let's talk about money now. If you're not doing on-calls, you're just doing standard hours, then your salary will be 3,300 to 3,500 net per month, which is quite good amount of money. And if you do on calls, then it can go above 4,000 euros. And I think this is the same amount of money we get as a junior doctor in USA, UK, and all other main countries. There will be a little bit of difference, but I think salary is almost the same everywhere at a junior level. At senior level, at consultant level, it varies from country to country. Then another plus point is if you're married, then your take home will be more because you will be given tax benefits, which is good. Get married. If we discuss about timeline, how much time will be required, so you need to pass your B2 language exam, B2 level German language exam, and it will require you at least 9 to 10 months. Why? Because it is a new language. For English, because you already know English, you speak English, you have done your medical college most probably in English, so it's not difficult. But German language is a bit different. I wouldn't say difficult, but it is different. Document paperwork, it will require you another 6 to 8 months. And once you clear your exam FSP, so it will require almost 2 years, I would say, from the start, from the very first day you started preparing for German language exam. So the main barrier is language. That is the main reason why people do not want to pursue Germany. Whatever state you choose, There will be a different type of document requirement, and how long will it take to process that. It varies from state to state. And then your medical university, how they are going to respond, all that things. The reward is good, training opportunities are great, and the jobs are well paid. The health sector is really good as well. There is a really good Facebook group called Doctors Going to Germany, and it has about 71,000 followers or members, and very active group. People are really helpful. I joined to just see what things are going on and how helpful it is, and I found out it is really helpful. So if you want any further information, you can join that group and ask that in the group. So the process isn't easy, of course. It's not very different, novel type of pathway, but the destination is worth it. Start today, and within 2 years or 2.5 years, you would be able to work as a doctor in Germany. Good luck, everyone. If you want me to make more videos like this, different pathways in different countries, just subscribe to this channel, comment below, and I will keep you updated.